Hey, Kenny. What's up, brother? How you been? Whoa, what is that, dude?
Good. I think I got a goiter. I was diagnosed with hypothyroidism.
Does it hurt?
Yeah, a little, but I have mostly difficulty swallowing. You know,
Man.
anybody knows more about it?
Yeah, man, I got a couple resources, man. I got something you can check out right here.
Hello everyone, my name is Ronald and I'll be joined by Josh, Sunny, Kenny, and Jesus. This video is brought to you by San Joaquin Delta College Nursing Program, and what we will be discussing about is hypothyroidism in adults. What is hypothyroidism? First, let's start with the thyroid gland. This gland is mainly responsible for making food into energy for your body, also known as metabolism. Hypothyroidism occurs when the thyroid gland slows down and the production of a hormone is drastically decreased. For example, consider if you typically get 8 hours of sleep every night and one night you get only 4 hours of sleep. Less sleep means you'll be slower and more sluggish.
Pathophysiology. Hypothyroidism happens as a result of the thyroid gland not being able to release T3 and T4 hormones, or triiodothyronine and thyroxine. When the thyroid hormones decrease, the hypothalamus releases TRH, or thyrotroponin releasing hormone, which tells the anterior pituitary gland to release TSH, or thyroid stimulating hormone, which then goes back to the thyroid to tell it to release more T3 and T4. It's like one big messenger chain. Hypothyroidism happens as a result of any of these processes not happening. So either the thyroid gland doesn't produce T3 and T4, could be because of damage, could be because of nutrient insufficiency, or any of the other messenger chains being broken. So the hypothalamus not releasing TRH properly, or the anterior pituitary gland not releasing TSH properly, because ultimately, if one of those things are not operating like they need to be, then the message is not going to get back to the thyroid gland that it needs to produce more T3 and T4, thus hypothyroidism.
Okay, let's talk about the main causes of hypothyroidism. Starting with Hashimoto disease is the most common cause of hypothyroidism in the United States. It's an autoimmune disorder in which the body's immune system attacks the thyroid gland, and over time, this leads to chronic inflammation and reduced thyroid hormone production. Another cause is thyroid surgery. All or part of thyroid is removed, often for cancer, nodules, or hypothyroidism, and there's left thyroid tissue left to produce hormones, which results in permanent hyperthyroidism. And next is iodine deficiency. Without enough iodine in the diet, you cannot produce enough T3 and T4 hormones, which can lead to hypothyroidism. And certain medications like lithium, miodarone, and thalidomide will cause hypothyroidism as well. And some signs and symptoms of hypothyroidism include brain fog, where you might have difficulty concentrating, or the feeling of forgetfulness. You might have hoarseness, which is like raspiness of your voice, numbness in the hands, fatigue, and dry, coarse skin or hair. Let's talk about some complications of hypothyroidism. Starting with goiter. Goiter is enlargement of the thyroid gland, usually from chronic stimulation by TSH when the thyroid doesn't produce enough hormones. It will cause visible swelling in the neck. Patient may have difficulty swallowing or breathing. They might report no pain. And another complication of hypothyroidism is myxedema coma. It's a rare life-threatening form of hypothyroidism that is often triggered by infection, surgery, cold exposure, or suddenly stopping your thyroid medication. Symptoms include altered mental status, slowing of the heart rate, slower breathing, hypothermia, and severe low blood pressure. It's a medical emergency with high mortality rate if left untreated. And the final complication is peripheral neuropathy. If you leave it untreated for a long time, it will cause damage to your peripheral nerves, and it can cause burning, tingling, or pain sensation in your hand and feet.
Diagnostic tools. When it comes to diagnosing hypothyroidism, it starts with the physical examination, where a patient's medical history and symptoms are obtained alongside with an assessment of the patient's neck region. Commonly following a physical examination is a blood test, where a patient's blood is drawn to obtain their TSH, T3, and T4 lab values. These are important in determining the patient's thyroid gland function, with high TSH and low T4 values being indicative of hypothyroidism. On separate occasions, however, a thyroid uptake scan can be utilized. This involves ingesting a radioactive iodine pill and then scanning the thyroid gland to absorb its ability to absorb said iodine, with a low uptake of the iodine being indicative of hypothyroidism. The tool also helps to visualize the size and structure of the thyroid gland. Two other tools that can be utilized to visualize the thyroid gland are ultrasound or CT scans. Now let's talk about treatments. If the hypothyroidism is caused by an iodine deficiency, then the treatment would involve iodine supplementations. However, if the hypothyroidism is caused by a hormonal deficiency, then the treatment would involve thyroid hormonal replacement therapy. And this would come in the form of levothyroxine, liothyronine, or desiccated natural thyroids. And levothyroxine is the medication of choice with liothyronine and desiccated natural thyroids being alternatives that also work to increase thyroid hormone levels. One may be chosen over the other depending on the patient's response to the medication, if they have any allergies to the medication, or their current medical conditions.
All right, so moving on to nursing interventions. A couple things we can do is assess and monitor for potential complications, provide an emotional support, encourage rest and warm environments. Next, we could administer medications and provide pharmacological support, and initiate patient education and health teachings. Now, for the first one, obviously, this would be assessing and monitoring for potential complications because it's crucial for early detection. This can help prevent symptoms, optimize treatment, and the provision of individualized care for each patient. Next thing we can do is assess their vitals, which helps detect abnormalities or additional signs of cardiovascular complications revolving around their heart rate, blood pressure, and respiratory rate. Monitoring for signs of hypothyroid crisis or mixed edema coma is also extremely important, so be aware of extreme fatigue, confusion, lethargy, low heart rate, and low respiratory rate. Next, we can monitor for more complication regarding the cardiovascular system. So high cholesterol, hypertension, and an increased risk of heart disease. Make sure to monitor the patient's lipid levels and the blood pressures regularly. Next, we can administer meds and provide pharmacological support. Now, this will involve levothyroxine and liothyronine, as mentioned earlier in our medication slide, as well as using them in a combination therapy. Next, we can initiate patient education and health teachings involving proper medication usage and instructions, the importance of rest, and the education on the importance of follow-ups. Now, nutrition, skincare, medication, and being able to report signs of too much or too little medication are also important, as we want to prevent constipation, monitor the patient's weights daily, make sure to take care of the skin barrier, and look out for any skin sores, so moisturize frequently. And for the medications, you want to stick to the medication plan. This makes sure that you're getting the adequate amount of medication at the right time. So in regards to community resources for our patients with hypothyroidism, we have San Joaquin County Hospital, we have Dignity Health, community medical centers, and San Joaquin County Human Services Agency. For San Joaquin County, they have a dedicated endocrinology department that is dedicated to treating diseases related to the immune system, and this includes hypothyroidism. San Joaquin County Human Services Agency, this helps provide aid for patients that require assistance with general living and medication costs, as these can be quite pricey without insurance. This also offers services to older adults as the risk for hypothyroidism increases as you age. For Dignity Health, we have a doctor here within the city, such as Dr. Tarandeep Kaur, who operates multiple offices within San Joaquin County. And for CMC Community Medical Centers, they provide medical care and behavioral health services related to behavioral changes that might occur as a response to the diagnosis, regardless of the patient's ability to pay.